All right, well, welcome everybody and happy International Women's Day. I'm delighted that we have a pretty good turnout. I know people are still coming in, but let me give you a quick overview here. So we have 4 panelists who are gonna speak for about 15 minutes each, and afterward we'll be taking questions. So please try to save your questions until the end, and you could type them in chat. And just remember, this is not a debate about abortion, and anyone trying to change the subject to that or disrupt the meeting will be removed. For those of you who don't know me, my name is Stephanie Cholensky. My pronouns are she, her, and I am the co-chair of the Socialist Party USA, and I also serve as the convener of the SPUSA's Women's Commission. The Women's Commission is open to all members in good standing of the SPUSA who face systemic marginalization because of their gender. So we're open to cis and trans women, non-binary people, agender people, intersex, gender fluid, genderqueer people. If you are interested in getting involved in either the party or the Women's Commission, I'll put my email in the chat, so please reach out. A little bit about why we picked this topic for International Women's Day. I mean, quite frankly, millions of people no longer have the basic right of bodily sovereignty. It is under threat for millions more, depending on what happens within the next few months. And the panelists will elaborate a little more on that. But even if Roe versus Wade stands, it has become clear that the Supreme Court, the current Supreme Court, has no interest in protecting reproductive rights, and it will uphold the most restrictive abortion laws, as that seems to be the way the wind's blowing. So this does hurt people who can get pregnant, but it really affects all of us. And the fight for reproductive rights really, especially now, has to occur on every level. Even local politicians need to have a pro-choice, a strong pro-choice platform, because these offices do actually have the power to crack down on things like crisis pregnancy centers, zoning, funding. It is something that is important, not just on the federal level, and especially since it seems like it's going to be left to the states. We really need to start paying attention to state elections. And I personally believe that third-party candidates can actually lead the way on this because they don't rely on wedge issues to get votes. So thank you again for joining us today. Our first speaker is Ari. Arianna Norris-Landry, sorry. I know her as Ari. And she has been an activist and an advocate for women and marginalized people her entire life. She started out fighting for the rights of migrant workers in Arizona with her mother. She fought for animal welfare, environmental justice, and indigenous rights in Alaska. She helped open a freedom school in Chicago. She was a legal observer in Ferguson. She worked as an advocate at the Alaska Women's Infant and Children Rescue Center. She founded an organization called Cahokia Cares, where she has been working to address the poorest towns and address the issues faced by the community. And it is in one of the poorest towns in the US. And she has also been very active in the Women's Commission of the Socialist Party USA for over a decade. So take it away, Ari.
Hi, my name is Arianna, and I guess she wanted a bit of history. That's why you invite the people over 60. When I was a kid growing up, I have older sisters, and we had to share a bedroom. And when you hear your older sisters whispering about things and you don't understand them, but it's like there was this great secret that women had. And I considered them women because they're a decade and a little bit more older than I am. And so when I heard these things, I didn't understand them. I didn't know why they would be trying to get one of their girlfriends down to Tijuana. I didn't know why they would be talking about so-and-so needed more money because we all lived in a barrio. Nobody had any money. And so it was a while before that kind of tripped the trigger for me. And when Roe came in, it didn't just suddenly happen. And I was actually just a beginning teenager when it happened. There was a big hoo-ha, but there weren't clinics suddenly popping open on every corner. So my high school still would expel girls who got pregnant, and or wouldn't let them graduate. There was horrible things that girls would do trying to get an abortion, or even to, as they used to put it, get unpregnant. Everybody says wire hangers, but the old grannies and stuff would tell you crochet hooks. And then later on in my time in the service, I saw women try using broken glass. One lady tried drain cleaner, which was absolutely horrific. And so it's not that women don't want to be pregnant kind of thing, that it's just an everyday thing. It's not a, oh, I'm going to go get an abortion. I firmly believe every woman has to have that talk with herself and decide for herself, because it is such a dangerous thing to do for yourself. You have to go out and get it, and it has to be safe. It has to be legal. And I don't want us to go back to those days where the secrets were kept and you didn't talk about so-and-so who vanished your freshman year and you never saw her again, or the girl down the street, who suddenly showed up with a little brother that was a baby, and things like that. I got involved then with my sisters in the women's movement because it became really clear very quickly that Roe was not going to protect us. The only thing that would protect us as women was the Equal Rights Amendment. And that's always been part and parcel of the work that I've done, is bringing that back again. Actually, I think it's been 2 years, it might have been 3 years ago, we finally passed it in the state of Illinois. And that's really strange for me because in 1987, I was still fighting to pass it in Arizona, which never has passed it. And it's a hard thing for women to talk about. It seems like it's still kind of a secret. I don't see a lot of women going out and saying, I'm pro-choice. And I know that it's a difficult thing to do, but I want to encourage everybody who's here, no matter how you identify, to understand that it's the people you know that are going to get hurt if they make this illegal. If they make it so you cannot go and get an abortion and it's safe, and you're not going to be at the whim of some stranger or something you read on the internet. And I think the best thing that I can say about it is a choice for the women, and it should be for the women, not some senator someplace making a choice because he gets money from somebody or thinks it looks good on his resume or something like that. I was 7 months pregnant with my son when Roe had its 25th anniversary, and I was huge. And we had a big to-do up in Alaska for it. And I walked up, and of course the protesters were outside, and they all thought I was there for them because I was very, very pregnant. And I walked up to them and I was like, I need to get through. And they were like, oh my goodness, you're here to join us. And I said, no, I'm not. I'm going to the party inside because this was my choice. And it was. And I have stayed that person all my life because I've seen, and if you don't believe it's necessary, hang around with teenage girls for a while. Because sooner or later, somebody's going to come to you and say, I need to get the morning after pill, or I'm afraid that this happened. And I don't want to tell my mom, and things like this. And I can't, and we're talking present day. And when they don't know the things they should know about their own bodies, when they don't know how to get help, I think it's up to us as activists to be that person for informational purposes or to actually help them get transportation or whatever's needed. And I think that we need to start organizing now, because nobody thought that Texas's BS was going to last. And yet we have women that are now coming to Illinois from Texas to get a legal abortion, because you can't get into the one Planned Parenthood in Missouri because it's absolutely packed out. And they also have those restrictions of, like, you have to come, you have to have an ultrasound, then you have to see the same provider again, et cetera, et cetera. And it can take up to a week to just get the pills. We're not even talking a surgical abortion, just the pills. And think about staying in a hotel for a week in a downtown. So $100 plus a night after you've driven 400, 500, 600, 700,000 miles. It's a travesty. And the only way we survived back in the day, I talked to my sister the other night about this. I said, what did you do? She said, we talked to each other. Those of us that didn't have cars, we knew people who had cars. We'd find out, you know, we'd all get together. I was like, why were you always trying to collect money for people? It was because they needed gas money. And that's what we have to do again. We have to get back to where women are talking to other people and saying, look, if this happens, this is what we need to do. I'm somewhat protected in the state of Illinois, aside from my age, making me out of the game. Illinois does have its own constitutional amendment that makes it legal here. But it's also the home and the birthplace of the Jane Network, which was a network of women providing each other abortions back in the day, or getting them to where they could get an abortion. So it's not going to go away until we make it go away permanently and people see us as equal citizens. And all of us get to make our own choice and we don't choose for other people.
Thank you so much, Ari. I really appreciate your perspective, because there's a lot of people that don't, you know, me too. I mean, I don't know what it was like before Roe versus Wade, and I can imagine it, but it's scary that it seems to be that's where we're going back. One thing I wanted to say is a lot of people have told me that, a lot of people have the attitude that since they're in a state where it's legal, you know, it's not really their problem, which is incredibly selfish. But I think if you're in a state where there is a constitutional amendment, or it's unlikely to be banned, you have even more responsibility in some ways, because people who can get pregnant all over the country are relying on your state, because that's where they're going to have to go. So, you know, even if where you're at, you're protected, first of all, that could change, especially if so many states around you make it illegal. And second, you know, people will rely on that. I know in Minnesota, we're basically surrounded by states where it's incredibly hard to get an abortion, and Illinois is the same. But thank you for sharing that. All right, our next speaker is Kia. Her pronouns are she, her. She joined Pro-Choice Washington as executive director in October of 2020 and brings more than 12 years experience to international public health, global policy for gender equality, and systems strengthening. She earned a master's in international development economics and a master in public health from Johns Hopkins University. Go ahead.
Thank you, Stephanie. And that was a really appropriate segue to my section. So good evening, everyone. As Stephanie just mentioned, I'm the executive director of Pro-Choice Washington. And as most of you know, or could assume, Washington State falls into the category of states that has protection. So we are considered a safe haven state. We codified Roe v. Wade into law here in the early 1990s after decades of organizing, and it was passed with something called Initiative 120, and it has been in place ever since the early 1990s, one of the first states to do so. However, one of the most important things that we recognize here in Washington state is just because there is a baseline foundational legal protection, which is not nothing, as we've talked about earlier, there is still deep inequity based on where folks live, what their income level is, what their citizenship status is, their race, gender identity, all of these factors within Washington state continue to force us to look deeper and deeper into what are the nuanced barriers to access around abortion care, reproductive care, and sort of the whole spectrum of those services. We also are not immune to the trends that you see around the country. So we have recently seen escalating clinic harassment and violence, particularly on the east side of our state. As you might know, the east side of our state is home to the Proud Boys and other white supremacist groups. And a lot of the groups that are anti-abortion and protesting in front of the clinics are actually run by the same folks who are running the white supremacy groups on Eastern Washington's across the state on the east side. We also know that there are fewer clinics and fewer providers east of the Cascades. So if you're in Seattle, there's plenty of access. If you're in Spokane, far less access. And so when we think about being a state-based organization, the nuance that we talked about earlier around what we're talking about in the municipal level, the city level, as well as the state level is really essential as we dig down into what it means to actually get access for everybody in our state. What is really important in this moment for us is what we were talking about before. What does it mean for Washington state and other sanctuary states if and when Dobbs is upheld and Roe v. Wade is overturned for all intents and purposes, which we still imagine will take place in June? So as a safe haven state, we have an incredible responsibility to receive patients. And Guttmacher actually estimated earlier this year that we could see a 385% increase in patients seeking care in our state from surrounding states, including Oregon, which is also a safe haven state. So really when we think about access, policy is defined at the state level, but access is not. And so when we think about how we get lawmakers and activists to support the infrastructure within a state that's required to receive these patients, while recognizing that it won't just be Washington constituents who will be needing that care, is going to be a really nuanced conversation that we're going to need to have over the next 6 months and then well beyond that. And there's a couple of things that we're concerned about with this trend. One is that we don't have sufficient infrastructure as it is. There are still a lot of people within Washington who don't have access. And the other is that providers are already seeing this increase in this trickle and are warning us that we are just not prepared emotionally, physically, monetarily, all of the pieces. We just do not have the pieces in place or the support in place to make sure that we can receive all these patients with love and generosity. And one of the things that we're starting to see, it's a really concerning trend and one that is essential for folks who are in sanctuary states to be aware of, and to the point of, you know, we cannot let up the fight in these states, is that we're starting to see a moderate backlash to being a sanctuary state. So when you have a health system or any system that is going to be taxed by folks that are outsiders, whatever that definition is, you will see backlash to protecting people who are local or a particular profile to accessing that care. So we're already starting to hear little concerns about what it will mean for other people outside of our state to tax our health system. So that's a trend that you really need to watch for many reasons, but as an advocacy organization, because that can very easily lead to more and more conservative elections and more local organizing on a more conservative line. And it's very easy to erode that pro-choice protection that we have in place. And I think that leads to my next point about elections and one of the things that we need to really work on. So as you may be aware, the Texas policy actually took 15 years to pass, a little bit more probably. And it was a very intentional process around turning municipal, local, school board, like judge seats, all these very local election races. And then by the time this was introduced, that infrastructure was in place. And so it doesn't take that much to overturn elections that people are not paying attention to, even in a progressive state. And we're seeing that a lot in Eastern Washington, that same area where we're seeing clinic violence, we're seeing white supremacy uprisings, we're seeing school boards in these smaller elections being overturned. And even if you're just talking about a position that defines broadband in a particular area, that impacts telehealth, which might be the only way for somebody who's in a rural location to get abortion care. So the nuance around what it means to participate in all elections is significant, because when we just focus on the flashy national level pieces, we sort of miss what's happening and where the actual work needs to take place. And so obviously we have the midterms coming up this year. That is a huge push. And one thing we always say to folks here is, yes, we are a sanctuary state, and we are very lucky to be so. And it is only as secure as your state legislature. So it is only a vote away for that not to be the case anymore. So I think folks underestimate how easily that can be switched, especially when you're not paying attention to the narratives that are happening at the community level. And we take for granted the fact that a sanctuary state exists forever. So it's really one of these challenging arguments for us to make, which is, yes, we're a safe place. No, it's not secure. Yes, we have access. No, we don't have access. And really making sure that states like Washington are not being forgotten in this space and are working really hard to create the blueprints and the backboards while other states continue to pass bans around us. So in Washington specifically, we work on a couple of different things to get at the nuance to barriers to access. One really key area that we see in Washington is around care denial. And it's a really nuanced, kind of wonky issue, but it's something that the West Coast has been facing, particularly states that are progressive and have abortion protection at the constitutional level. We're seeing an increase in merges between hospital systems. And often one hospital system is Catholic or a conservative private hospital, and one is not. But they are being subsumed under the Catholic structure, and we're actually seeing care denials take place within the hospital systems, even in a state where end-of-life care, gender-affirming care, abortion care is all legal and protected. At the individual hospital bed level, we're actually seeing denials. And at this point, we have 50% of our beds under those discriminatory policies. So even in states where you have structures in place, you have to keep an eye on where those other sort of movements are to remove access. And it's very subtle and it's very wonky. And so we're working on creating policy structure to have public accountability and transparency to mergers, and to actually have transparency around when care is being denied to people. And we've actually seen near-death experiences take place around miscarriage care when people are denied abortion services. Another one we're really working on is around financing. And so this is one of those barriers to access. We all know any healthcare issue, financing is a major issue. And that has to do with insurance coverage. It has to do with, not being covered in insurance or not sufficiently being covered. And also just means how we think about what it means to fund public services. So we're working on progressive revenue issues here in Washington state, because Washington has the most regressive tax structure in the United States, and also is home to 19 to 21 billionaires, depending on the day. And so our structure actually disproportionately taxes low income people and has very little tax structure for the ultra wealthy. And so we're working with a coalition to actually try to flip that structure a little bit so that you can actually fund family planning care, abortion coverage by Medicare, all these other structures that are absolutely essential for catching folks who are being lost with a basic access structure. And then to your point earlier, Ari, you talked about awareness and stigma. And so one of the interesting things that we're seeing now is a movement finally for folks to start saying the word abortion and to not being afraid to just unapologetically advocate for the issue itself. For a long time, we talked about safe and legal, or rare and unusual, or only if, and that really totally undermines the idea that it is a healthcare service that everybody deserves to access. It is not our place to decide if, where, when, and how that happens. And so that is a really important part of anybody who believes in healthcare access, to start speaking about abortion as itself without any qualifiers around it, because that's how we start to take it down. So we're doing that with communication guides, with how we speak about it on the world, our messaging. And also thinking about passing things like comprehensive sex education, which gives really young folks the language around how to talk about themselves, their bodies, their safety. And so it's all of these sort of nuanced and deliberate structures that have to be in place to actually safeguard what it means to have abortion access coverage. So all of this requires decades and decades of work. This is not an overnight process. It takes typically 5 to 10 years to pass a progressive policy. But it is something that we need to be working on. And that's another reason why not losing focus in safe haven states is essential, because if we roll back to a place where we're always reactive, you're never going to be able to build these structures. So Tara and Lily are going to talk more about what we can do about it. So I won't get into too much detail, but just wanted to break it down into 3 places where you have power. One is through your voice. So writing your story, sharing your story in your community or publicly, all of that helps to reduce stigma, being unapologetic about your perspective, not being worried about the term pro-choice, not buying into the politicization of a healthcare structure. And the second is powering your vote. We already talked about this. Participate in every single election, even if it's that random school board, it actually matters. And we've seen school boards be the place where really conservative agendas play out. And so if we're not participating in it because it seems too small, we are losing. And then the third is the power of your dollars. So obviously there is never enough resources in this issue area because we don't have access to corporate structures. We don't have access to traditional grant structures very often. There's a lot of people who are concerned about the political image of donating to the space. So really, if you think about giving your dollars to this movement, to abortion funds and independent clinics who are going to be the front lines and are actually providing these services, that's super essential, both in safe haven and not safe haven states. The Northwest Abortion Access Fund is a big one for the Northwest. Donate to advocacy organizations like the ones that are here today because they are doing the groundswell structures, and also make sure that you put your money behind the candidates who are really outspoken about abortion and reproductive justice, not just kind of wishy-washy and pro-choice, because moderate structures actually can be harmful over time. So I'm going to stop there because I could keep going, but I know we have other really wonderful speakers tonight. So just thank you all for listening.
Oh, thank you. Thank you so much. There are so many ways to get active. And I know a lot of people on here probably aren't big on supporting the Democrats, and I'm not suggesting you should do that. But even if you're not electoral politics, there's so much you can do. And if you don't know where to start, there's definitely people on this panel that can help you out. Even if they're not in your area, I'm sure they can connect you with someone who can. So please reach out and please get active. So thank you so much. Our next speaker is Tara Romano. Her pronouns are she, her. She is the executive director of Pro-Choice North Carolina, a statewide group that advocates for the policies and social support people need to support whatever decisions they make about their reproductive health, including preventing unplanned pregnancy, terminating a pregnancy, or carrying a pregnancy safely to term. And you can learn more about this organization and her work at prochoicenc.org. Tara has been at PCNC for almost 6 years and part of the NC social justice movement for 2 decades. And I was fortunate enough to meet Tara through Joshua Bradley's campaign, and I know she does really great work. So go ahead.
Great. Well, thank you so much for having me. And I really appreciate being on this panel. And so I'm going to share my screen. I just have some slides really just to help keep me focused. So I'm going to go ahead and share my screen. Right. And so we're just going to go over, piggyback on some things that Kia has said, but also just talk specifically about North Carolina and how folks can get involved, really no matter what kind of, where you might be living. And so, okay. Let's just start with the landscape of North Carolina. North Carolina is considered a hostile state for abortion access, and really like very hostile, it's considered. And now North Carolina, we are the 10th most populous state. So we're a big state. We have 14 clinics, which I know sometimes compared to our southeastern neighbors, like is a lot. South Carolina has 3, Tennessee has 7. But they are really clustered. And like there's one in the very western part of the state, there's one in the eastern part of the state, and then they're clustered, the rest of them are clustered in metropolitan areas. Not only, 92% of the counties don't actually have an abortion provider. And also I do want to mention, or 91%, I'm sorry. I do also want to mention that like the number of clinics you have isn't really the whole picture when it comes to access. Because there are some clinics like that only offer surgical abortion, or some that only offer medication abortion. And that which may or may not work for the patient. So that right there then also can impact what kind of access they have, even if there is a clinic in their area. And also some of the clinics only offer abortions some couple days a week. Like it depends, because, you know, they have to have abortion providers, particularly in the South. They will sometimes travel from other states, and so they can't be there every day. So it really is limiting. Like we have 14 clinics where we've worked hard to keep those 14 clinics, but it really isn't enough here in North Carolina. So let's go on to, and like I said, we're considered a very hostile state. And this hostility really manifested itself in bad policies between 2011 and 2017. Like we had more abortion restrictions pass in those 5 or 6 years than we had like in the previous 30. Not that North Carolina was considered like, you know, a haven for abortion access, but in the South, it was considered a more moderate state for a long time. We had a state abortion fund for a long time. North Carolina actually had legalized some abortion prior to Roe. So it was just like, it was, and of course what happened in 2011, like, or in 2010 election was, you know, a real big backlash to President Obama, right? Happened in a lot of state houses, saw very conservative gains in a lot of state houses, and that happened in North Carolina. And that's when you started to see a lot of anti-abortion bills being passed into law that had previously been able to, we'd been able to stop those, advocates could stop those bills. So currently in North Carolina, if you're a patient seeking abortion, you have to listen to a state scripted statement, which has a lot of anti-abortion and stigmatizing language in it, a lot of inaccuracies, and you have to listen to that. You have to wait 72 hours. You most likely have to pay out of pocket. North Carolina has barred all public insurance at the local, and that includes if you're a local, state, or federal employee. They barred all that insurance from covering abortion, and they've also barred private insurance in the marketplace, in the Obamacare marketplace, from covering abortion care as well. So, I mean, that right there is a huge barrier that a lot of people have to pay out of pocket. And that's something that can be like, even for, you know, an early abortion, that can be like around $500, which is, that's something that a lot of people don't have that kind of money for an emergency, whatever that emergency is. So that right there is a huge barrier. North Carolina banned medication abortion, telehealth, not medication. They banned telehealth in 2013. They're way ahead of the curve on that one, but they banned telehealth. So you cannot, like, even if it's a medication abortion, you have to go to a clinic. And if you're under 18 in North Carolina, you have to have the consent of a parent or a guardian, which is a huge barrier. And we do have a judicial bypass so that like a teenager, a minor, can go to a judge to ask for a bypass, which itself is a really a huge barrier. Although we have a good process in place to try and help minors who are accessing that, but that's another barrier that we have. We also have one reason ban. We've managed to block another reason ban, but we have this ban that says, you know, it's a sex selection reason ban, which is not, it's really just encourages, frankly, racial profiling of people from South Asian countries. And it hasn't been, that's not something that we think happens here in North Carolina, but it was just a way to shame and stigmatize abortion and really create barriers between providers and their patients. We have very robust conscience clauses in North Carolina, not just for like excusing people who don't want to be a part of an abortion, which has always been in place. But we have allowed it to be like lots more people who don't really necessarily have a lot to do with an abortion, but they can somehow make it known that they do not want to participate, and also really allow them to block things. And that is particularly with birth control. You know, pharmacists being able to block people accessing birth control because of their conscience clauses. We also have this random just intimidation law about like, we have a 20-week ban, which was recently ruled unconstitutional, but we've had a 20-week ban for a long time, which goes against the precedent set in Roe, a 20-week ban. But in North Carolina, they made this law that if you get an abortion after 16 weeks, you have to send your ultrasound to Department of Health and Human Services. We don't really know what they do with that. It probably just sits in a file cabinet somewhere, but the idea was that it was to intimidate doctors, right, and patients, to be like, we think you're lying about this, so we're going to require you to send this. And if you're under 18 in North Carolina, you cannot work at a clinic. So those are allowed. A lot of those laws have been passed, you know, like I said, in the past decade. We are considered a pretty hostile state when it comes to abortion access. So In a post-Dobbs world, it's a big question mark about North Carolina. We do not have a trigger ban. Like Tennessee has one, Georgia, I'm not sure if Georgia has one. Other states around us have one. We do not. Now, we also don't have anything that protects abortion access in North Carolina either, though. We do have a pre-Roe abortion ban on the books. We also have this 20-week ban that had been declared unconstitutional. They had passed a law where the doctor had to, prior to the abortion, provide the ultrasound and describe the ultrasound, and that law has been permanently adjourned in North Carolina. But really, honestly, like if they allow Dobbs to stand, if they outright overturn Roe, the idea of like what is unconstitutional is going to be called into question in the states. And so some of those laws, even though that we don't have a trigger ban, some of those laws that have been previously declared unconstitutional in North Carolina could just come back into force, because they could be like, well, maybe this is now constitutional, who knows? So it's a big question mark for us. And what we will see, what we anticipate is, like, if this happens in June, for a little while at least, we might be a place where people come to access care. People are already from South Carolina. South Carolina only has 3 clinics. We have 4 clinics, or 3 clinics just in Charlotte, which is right by the border with South Carolina. So we already see patients from South Carolina coming into Charlotte. We anticipate that we'll see more patients from Tennessee and some other places that around us that have trigger bans. We anticipate that North Carolina, while not really being close to some of these states, will be the closest state where people can access care. Now, we don't know that we can absorb all those patients. I mean, we don't have a ton of clinics, so that's going to be a challenge. We already know, we've talked to folks in Florida where they're passing a 15-week ban, that they're planning to get, North Carolina is going to be potentially the closest state for some of those folks to come to. So we might see an influx of patients, at least for a while. How long that lasts, we don't know. Like, I really do think we're one election away from North Carolina also banning abortion. We have an election in 2022, like a lot of places. Our entire legislature is up for re-election. We don't have a gubernatorial election, and we do have a governor currently who will veto anti-abortion bills, and currently we can uphold those vetoes. We have an extremely gerrymandered legislature. We have for a decade. It's been a persistent problem. We did get some good news from the Supreme Court yesterday that said the gerrymandering cannot continue, but I mean, we're still gerrymandered. So we'll be focused on this election in 2022. Because if we lose, if the anti-abortion folks gain a supermajority back, it won't matter that we have a governor that can veto an anti-abortion bill, because they will override that. So that's what we think when we say like we're one election away from able to ban abortion. So it's really precarious here. And we also know it's precarious for people in the state, but for people in the Southeast as well. So we're really watching that. Okay, and just to sort of give you also the landscape of like reproductive health care in North Carolina in general. We have 14 clinics. We have almost 100 of these anti-abortion centers, right? These fake clinics, you might know them as crisis pregnancy centers. We've got these here. They currently get $15 million in our state budget. They started out in 2013 getting $300,000. Now they are up to, less than a decade later, getting $15.8 million. We have not expanded Medicaid in North Carolina. We're one of the few states that has not. You can still technically be fired for being pregnant in North Carolina. Like, we don't have a good state protection against that. And we have a higher than average maternal mortality rate, particularly among Black women. So we are in a state that really does not prioritize reproductive health care at all. For people who are carrying pregnancies to term, for people who are trying to prevent unplanned pregnancy, and certainly for people who are trying to terminate a pregnancy. And so that's what we've got in North Carolina. And we're diverting money, which I think is not a terrible waste of taxpayer dollars, to these anti-abortion clinics that are basically there to push anti-abortion ideology. Now, in terms of like when Kia was talking about some of the local things that can be done, I do want to talk about, like, even though a lot of local governments don't necessarily pass like legislation around abortion or contraception, those kind of public health things, they can do a lot of good things, particularly even around messaging and around providing momentum for people to talk about supporting abortion access. I mean, they also can be really helpful when it comes to clinic problems, because, like if there's a clinic in a county or a city, the city can help with ordinances. So I do encourage folks to pay attention to their local governments check out city council and county commission meetings and definitely vote in those elections. In North Carolina, we have had 4 local resolutions calling for an end to the Hyde Amendment, which are the most of any state. Durham, the city of Durham just passed a reproductive freedom resolution last night, taking a stand that they're going to be a safe haven for reproductive and sexual health care, no matter what happens in the Supreme Court. About a decade ago, we had a CPC accountability resolution for a college town where they had a lot of these anti-abortion centers talking about like truth in advertising. And of course, like the local resolutions, they know they can be used to build momentum because we've had a bunch of very recently anti-abortion resolutions passed at the county level. They're in rural counties. They're part of a national campaign. I think it's Personhood USA has been doing it, and we've had them particularly out in the western part of the state. Now this is out there in the western part of the state. Those folks heard about it and they're like, nope, we're not going to let you pass that without us having a say in that. So, I mean, we can't necessarily stop those from being passed in some of those counties, but we can organize people to speak out. And I think it is important to do that because people think that in rural counties, they'll say things like people don't support abortion access here. I'm like, that is absolutely not true. You know, so having people speak out, having people challenge them on like, why are you taking this up when we don't have access to healthcare, when rural hospitals have closed, like helping people really take that narrative back. Like local resolutions and local organizing are great places to do that. And so I really quickly want to just also mention that clinic harassment in North Carolina, like in a lot of places, is horrendous and it is getting worse. It has definitely gotten worse in my 6 years here. We have, particularly in Charlotte, we have like a real hub of anti-abortion activity. They will have hundreds, sometimes thousands of people in front of a clinic. And we just don't get much help. We, even with local city councils who say they're supportive of abortion access, they're just real hesitant to do anything. And I think that it's probably the advice they get from the city attorneys. And we don't think it has to be that way. And that's why we think we need to do some organizing because people do get upset when they see people screaming at people going into clinics. I mean, this is an example of a flyer. Some of those, like they'll just target the clinic escorts, they'll target the clinic staff. And I do think actually, even one of the things I think about with how the Dobbs decision, one impact it might have is just really energizing the protesters, right? That they're going to be out in front of clinics, no matter what is it like in your state, they're going to be out in front of clinics. And so that leads me to like some things that we can do, even if you're in a state like North Carolina. And Kia mentioned some of those, which is voting in every election, supporting local abortion funds, supporting local clinics. Keepourclinics.org is a place where you can donate for local clinics. You know, advocacy groups that are doing work in the state that are really engaging in the grassroots organizing, like all of the groups here. And I would also say like raising your voice with the local, state, and federal elected officials, like it doesn't matter if they never are going to vote your way. They still need to hear from you. I think writing letters to the editor, talking to local media, however you can, I think is also important. It helps disrupt the narrative that we're evenly divided on abortion, which is not true. Most people support it. There's not a single state in this country where overturning Roe is popular. I would also say volunteering to support clinics in terms of like patient escorting. They always need that. And sometimes clinics also just need help, like, you know, they don't have a lot of money, and like helping to do landscaping or, you know, like making it a welcoming environment for patients. Ways that if you get to know your local clinics, you can be supportive in that way. And the last thing I want to mention is this Thursday, March 10th, is National Abortion Provider Appreciation Day. And it's particularly for independent clinics. Like there's always the slogans like I stand with Planned Parenthood, but a lot of independent clinics are really kind of out there on their own and don't get a whole lot of love. And so I would really encourage, if you've got local clinics in your area, send them a postcard, like not a letter they have to open, but like a postcard thanking them for what they're doing. Follow them on social media. You know, go ahead and send your thanks on social media, tag your local clinics. It's just a good way to also disrupt the anti-abortion narratives, to just really be very, very open about supporting abortion access using the word abortion, all those things that we've talked about. All right, I'm going to stop my sharing and thank you all for joining us tonight. I'll turn it back over to Stephanie. Stephanie, I can't hear you.
Sorry, I thought I unmuted, but I didn't. Yeah, thank you for sharing. It's great to see that work going on in North Carolina. Something I was just thinking, you're absolutely right. When you say the media portrays this as if it's as if America is split right down the middle, but that's just not true. 75% of Americans want Roe versus Wade upheld. 60% of Americans think abortion should be legal in all or most cases. It really depends on how the question's asked, but it's usually around 60%. And even in the Republican Party, only 22% of Republicans think that abortion should be illegal in all cases. So the laws that are being passed are not popular, and they definitely don't represent what Americans want. Not that it should matter, even if my right to bodily sovereignty isn't popular, I should still have it. But I think it's even more shocking that this isn't even what most Americans want. So thank you. So our next speaker is Lily Bolourian, I think. You can correct me if I'm wrong. Her pronouns are she, her, hers. She is the executive director of Pro-Choice Maryland. Lily is an Iranian American organizer and writer who joined Pro-Choice Maryland as executive director in November 2021, with well over a decade of experience in the abortion access and reproductive justice space. Lily holds a master's degree in health law and policy from Hofstra University School of Law and is currently a doctoral student in bioethics at Loyola University in Chicago. Go ahead, Lee.
Awesome. Well, thank you so much for the introduction, and thank you for having me. It's very much an honor to be here with such awesome people, and happy International Women's Day to everybody. So I think I want to start by kind of saying my approach to abortion access and reproductive justice is heavily rooted in my identity. I'm a first-generation Iranian American. My parents were asylees, and I come from several generations of women who've had abortions, whether legal or illegal. They've had abortions. I'm one of them. My mom's one of them, my grandmother, my great-grandmother. And when I was learning about abortion rights and access growing up, it was shocking to me to hear that this was something later on to find out that it's something that's contested or that it's even stigmatized in any way. I grew up in this bubble in my home and among my community where abortion access was an act of love. When I would hear about stories of the women in my family getting abortions or helping their friends get abortions, it was an act of just joy. They would get together. Sometimes it was secret from their husband, sometimes it was not, but they would describe a situation where you had a group of super supportive individuals around you, holding your hand while you're going through this procedure. And while sometimes, having an abortion, it can be a difficult decision, of course. But for the most part, people feel relief after they have abortions. People feel good about them. And so I think that's really critical to understand, and it really colors the way I view all of this. And I think one other thing that is very important to contextualize all of this is that you really have to understand the goal of the anti-abortion movement. They're not here to compromise with us and be like, all right, we'll stop harassing clinics and attacking doctors and threatening them if you guys ban abortion after 3 months. That's not what we're dealing with. And it's very, very important to understand that, because we have had in general a lot of compromise with these individuals, and that has kind of led us to where we are today. The goal of the anti-abortion movement, it is a global movement to ban, criminalize, and control all pregnancy outcomes. It is a fundamentally white supremacist movement. It has its roots in white nationalism. It has its roots in protecting the white family and the nuclear family. It is a fundamentally racist movement. And so we are fundamentally the moral ones. We're the ones who are on the right side of this, no matter what the media wants to tell you, or what even, you know, Democratic politicians who are allegedly pro-choice, the way that they talk about abortion access, you would think that it is this really bad thing that we have to sometimes be okay with. No, it's not. It's a great thing. It's an awesome thing. It's a wonderful thing. And also it's none of anyone's business, period. So that was my preface. So now let me get into Maryland. So Maryland, I'm a lifelong Marylander, love it here. We're considered a safe state. We call ourselves lovingly a blue state, but I'm gonna level with you. Our governor's a Republican. Every session, we have at least 5 anti-abortion bills, disgustingly bad ones, introduced. Thank goodness, you know, organizations like ours and others work really hard to track this and to be like, hey, we need to, you know, stop this. And luckily we have been, you know, successful in stopping that legislation. But the fact that in a state like Maryland that people consider to be so safe, there's such an activated and organized and well-funded anti-abortion movement, it should really show everybody that this is a completely a movement that is so well organized and well established that they don't care how popular they are. They don't care. They will continue to push how clearly, we just discussed this, right? Most people in this country are pro-choice. They don't care. They're not worried about what we think. They have one thing in mind, and that is to criminalize and ban abortion. And that will harm the most marginalized communities the worst. And we know that. We've seen it happen before. We see it happening in other countries that have really restrictive abortion laws. It's a tragedy. And so Maryland in 1992, we codified Roe versus Wade under a referendum. It came to a referendum, question 6. Over 60% of people supported that. Over 60%. And now Maryland is a progressive state with a history, though, as a refuge for Catholics. So we have this very, very heavy Catholic influence. And yet over 60% of Marylanders were like, no, we want to keep this law. We want to make sure it's safe. That's very, very important, because that has only, in my opinion, strengthened. And that, again, through the work, decades of work of organizers, of just people who are willing to put their lives on the line for this issue, is how we've gotten here. And so one of the things that's really special about Maryland is that we have some of the best laws when it comes to later abortions. And the reason that this is really critical, especially in this context of this discussion, is that if we get the ruling that we're all expecting, people are going to be coming to our states as soon as they can. And that means that they're going to be presenting sometimes later in pregnancy. We're going to be seeing people, and we already are seeing people who might have found out that they were pregnant, perhaps 8 weeks gestation, but are not able to get to Maryland until sometimes 18, 20, 22 weeks. And that means that it's critical for states like ours to not only ensure that that remains legal, but to ensure that we protect the providers and support the providers who are willing to provide this care. Later abortion care is so critical to all of our communities, and only very few providers publicly will say that they provide that care. And so Maryland is home to a few of them, and we're very, very lucky to have them. And so the election in last November, of Glenn Youngkin in Virginia, their governor, it was a tragedy. And what that's going to mean is that, you know, our friends at Pro-Choice Virginia and all of the organizers there have worked so hard to make Virginia have good laws on abortion. But one election, one governor threatens decades of organizing work. And that means that it is even more critical that Maryland remains a strong access state, because now our friends in Virginia are going to need to come to us more and more, and we have to be ready for that. And so our election, Maryland's gubernatorial election, is in November. And like I mentioned before, we currently have a Republican governor. we have the opportunity right now to, elect a pro-choice governor in Maryland. But we have to be willing to push really hard on that. And that means that the progressive movement, that means that folks on the left, we also need them to deeply embrace abortion access as critical to our whole movement. Abortion access is not certainly not a women's issue, and it's not a siloed issue. It impacts all of the other issues that we all care about, especially as socialists, especially as feminists. This is really important to understand that at this point, no policymaker, no candidate should be able to call themselves a progressive or a socialist if they don't have a platform on abortion access, period. And that goes for almost everything that you're running for. If you're running for school board, I want to know what you feel about the curriculum. I want to know how you feel about how you're going to care for teenage pregnancies, individuals who choose to have their children. How are you going to make sure that they're treated while they're in school? I want to know. I didn't really hear too much about abortion growing up in school. I was always the one talking about it and bringing it up, like, hey, teacher, let me know. These are critical, these are decisions that are made at the local level. And so every single town hall you see, go to it. Every single opportunity you have to get face-to-face with policymakers and with candidates, go there and ask them specifically how they feel about abortion. And if you see them hedge and say, well, women's healthcare is important, stop them. Because what they're doing is stigmatizing abortion, and they're making all of our work so much more difficult. We need to demand more of people. And hey, I understand if politicians don't know how to talk about abortion, call one of us. We will help you. There's so many people who I would love it. I would drop whatever I'm doing if anybody wants to talk about how they can message about abortion, because it's so important. And it's also really a lot easier than people think it is. Again, we're the moral ones. They're the ones who are trying to criminalize pregnancies. We're the ones saying that your body belongs to you. There's no both sides to this. No, period. We are the moral ones. We have to keep that focus. Kia mentioned, and I really appreciate this, the backlash that progressive states receive when they go super all in for abortion access. And I'll be honest, we have about 3 bills right now in the Maryland legislature that are pro-abortion access that we support, and I am so happy, and I pray that they pass. But of course, in the back of my mind, part of me is so scared for how the antis are going to respond. And that's just how things go. And that's why the vigilance can't just stop at elections. Elections are great. They're one tool in the toolbox. They are not they're not a panacea. We know that, we've seen that. And so it's really critical that movement building is not just focused on election work, but that it's part of movement building, election work. So I think that one of the biggest things that we're going to also have to consider is that in a safe state like Maryland, where abortion access has been codified, there is a bill right now to further codify it in our Constitution. The consideration that we need to have is that if the Supreme Court chooses to rule in the Dobbs case unfavorably to us, then what is to stop the Supreme Court from accepting a personhood case next, and from declaring that all fertilized eggs are human beings with the same rights and privileges as you and I? The supremacy clause means that would invalidate everything that we've done legally. If they can turn around and say, okay, but a fetus is actually has a social security number now, they can absolutely invalidate everything that we've done. And believe me, if I can even think this, they have dreamed it, they have written it up, they are creative and scary, and they will try whatever they can to get to their end goal, which again, criminalize all pregnancy outcomes. So I think it's really critical that when we're talking about getting involved, I want to again put my voice toward local abortion funds. People, I know that this seems really, really scary to everyone, and it is, but this isn't brand new to all of us, to a lot of us. We've been predicting this type of movement. We knew we were always one election away from abortion access on the national level being cut away. And people honestly wrote us off a lot. And that's true. And I don't have any grudges. I want to move forward with it. But the truth is that we were ignored a lot as organizers in this space, that this is a critical issue and that we might have a problem. And so I really think it's very important that we just move forward with the belief and with the understanding that abortion access is critical to all of our communities and to everyone that cares about marginalized people in any way. Abortion access has to be centered to that work. It just has to be. And so I challenge everybody on this call to not just be pro-choice, but to be pro-abortion and to be proud of that, to be proud to say the word abortion. I'm really mad at JK Rowling right now. I think I always will be, but I always say abortion's not Voldemort. Like, you can say abortion, like nothing's going to happen. It's good. It's fine. It's a word. And the antis have done a really good job of stigmatizing a word. So reject all of that. And again, ensure that in every space that you're in, every progressive space that you're in, ensure that people are taking up abortion access. This is really, really critical, because together we can stop this tide, but we can't be siloed, and we can't be splitting our resources in the ways that we currently are. It's just not a sustainable strategy. So thank you all so much. I think I've talked a lot, and I'm really grateful, and I'm excited for the Q&A.
Definitely. Yeah, thank you so much. I really appreciate your perspective, and really, as scary as the news around reproductive rights is, what keeps me going is seeing so many brilliant, qualified, passionate people that are working on this issue. So now we're going to do our question and answer period for about a half hour. So if you have questions, you could either type them in the chat or raise your hand, and I think I can unmute you. I know people have questions, and we have quite a few people here, so. Well, I'm going to ask a question. Oh, I see a hand. I see a hand. Where did it go? Well, okay, someone has their hand raised. Joshua Bradley, I'm going to unmute you. Yeah, there you go.
Can you hear me?
Yes.
Okay, I've got a question. As a candidate for local office, one of our platform points is focused on reproductive health in general and abortion specifically. What are the as far as the crazy gun wielding fetus porn people that tend to surround clinics? Other than, I think Charlotte did it, has there been any other success in setting up buffer zones around medical facilities to prevent those people, like rigid sound ordinances, and potentially if we get people away, that would be even better. Is there any, I think Charlotte's done it, but are there any places around the country, and any advice on how to get something like that passed? Yeah, over. And that's to whoever would know.
Missouri has trigger laws like crazy, and one Planned Parenthood in St. Louis, and they were having the problems you're talking about. And they were able to get it to where the people that had the bus with the sonogram available and things like that that had before been parked up right in front of the clinic, they now have to be a city block away. And they have to stay out and things like that. So your zoning and stuff like that is effective if you can get it past the local city council. St. Louis itself is pretty blue. The rest of the state, don't even ask. But if you have a blue enough area, go for it. I mean, you know, as far as keeping people away from the area.
We had to follow up on that. Thank you, Ari. There in Spokane, they were able to use a noise ordinance to remove a group from a clinic. There's a group that's managed by the same white supremacy group called the Church at Planned Parenthood, which is a protest group around Planned Parenthood clinics in Spokane. And so they were able to utilize the noise ordinance to create space. It's not sufficient, but something.
Yeah, I will add, Charlotte actually, their noise ordinance recently somehow really has been weakened. But they were really reluctant to do anything. And I like for North Carolina, one thing I will share, and it's something that you can look at. Like we have a number of ordinances already on the books, and part of what we want to do with some city councils is like just enforce these ordinances. Like we're not asking you to do more things. And one of the challenges, I think we probably all experience this, is like, how do you do this without also having the police all be more involved? Because that just doesn't feel safe. And for us, in my experience, the police are not actually helpful anyway. So it is a struggle of like, what do you do? Like, can you do from, and I think it's a question I still don't know the answer to, but like, how do you figure out like some things that maybe your local government can do, but in ways that aren't going to just like reinforce like sort of a police state, you know, because that really doesn't feel good for a lot of people. But there are times when like you also do need the police to help you with some of these really big threats. So I think it's really, I think if you're going to do something like that, I would encourage you to reach out to advocates in your state at least, because what they can do is probably put you in touch with, even if they don't know, there's other places where they've done it that have passed like court muster, you know, and so that they don't get, because that's one thing like a city attorney will say, will be like, well, we don't want to be sued, you know, so you can find ones that maybe they're not perfect, but they could at least, they've already been through the legal process, so they could be defended in court, and that'll be something that will go a long way to your city or your county wanting to pass something like that.
Thank you. Next on stack, I have Hazel Rodriguez. Let me unmute you or allow. Okay, you should be able to talk now if you unmute. I can't hear you. Make sure. Can anyone else hear? I can't hear. You might have to type your message in chat. While we're waiting, I have a question to, well, Lily, you talked a little bit about it. I'm kind of curious if people have any idea of why white supremacists, there really is such a strong link between white supremacists and the anti-choice movement. And personally, I think it has to do with how white supremacy and misogyny and what I call, they call it like men's rights, but I call it pro-patriarchy. I think that's a more accurate term. But if anyone has any thoughts of why it's so popular with them, and honestly why the right has taken direction from these hate groups.
I'm happy to start a little bit. This could be a whole presentation in and of itself.
Yeah.
So if you're interested, look at the Western States Institute. They do a lot of work on white supremacy, and they do talk a lot about the link, but just really high level. And I think, Lily, you have a little bit more background on this, but originally the anti-abortion movement was really actually about making sure that white women weren't able to get abortions. And it was really about making sure that white populations continued to populate while they were still doing reproductive coercion and reproductive violence against people of color and Black people. And so that interaction is still there. And that history of trying to create a white population in Washington, but the whole United States is core to why there's interaction between those two. And then I'd say also on top of that, these are all about preventing rights and restricting groups of people. And so when you actually work towards the prevention of abortion rights, you're really working towards creating the political and financial infrastructure for reducing rights on a broader scale, like voter rights, like broader health rights, like, well, all the rights that we're seeing eroded, LGBTQI rights. So it's an easy in that was built out by the religious right over the last several years, decade plus. And so there's sort of twofold that I've understood that interaction. But I turn it over to my fellow panelists who might have more.
Yeah, I think you really hit the nail on the head, honestly. You know, fundamentally, the white nationalist movement exactly is trying to establish a white nation, is trying to establish a, you know, a situation where they are absolutely, a white supremacist wants to create a white nation. And so in order to do that, you need to be in control of birthing, period. I mean, in order for you to ensure and maximize the strength of your white nationalist state, you have to ensure that people are, first of all, fundamentally put into their roles as in the unit of the family unit that they believe is correct. But also to ensure, yeah, that there are more white children born, period. And that's really what it comes down to. And that's why you see things like sterilization occur, forced sterilization occur of people of color, because, and that's all of this is connected, by the way, it's all part of the same spectrum. But I think that is fundamental to the white nationalist state is the need to control birthing outcomes. We've seen that before. We even saw that in Nazi Germany, that almost one of the first things that Hitler passed was to control abortion access. And in fact, abortion is still largely illegal in Germany. They still are, you know, socialists are fighting really hard to overturn that Nazi era law, but very much fundamentally, they require that kind of control in order to create their state.
Definitely. And I'm sure many of you heard anti-abortion activists have used examples of racism in, yeah, I know you guys know what I'm talking about. I can't think of the specific instance, but they'll say, well, see, Planned Parenthood is racist because they did this, that, and the other thing, as if that applies today. But does anyone know what I'm talking about?
Well, they did a lot of eugenics back in the day, but
Yeah.
that was partially, again, speaking to what Lily was just speaking to. 100 years ago, 110 years ago now, you could walk into any drugstore and get over the counter. You didn't even have to talk to the pharmacist. You could, you know, it was aspirin. They had various different types of liquors and pills and things like that a woman could take home and have her own abortion, and nothing was ever said. Now, granted, these weren't medically approved, a lot of them, some of them were, but the fact that we still have, for a developed nation, an excruciatingly high maternal mortality rate infant mortality rate, we're already killing babies, as they say, by having no health care for marginalized women. So we need to protect each other, is the way I look at it.
Yeah, exactly.
And I would just add, I think, one of the things too is the anti-abortion movement and the far right in general is good at co-opting movements, like talking, like presenting themselves as the feminists, as the anti-racist and that kind of stuff. And I mean, one thing you think about is like the things that we talk about in progressive circles, like they resonate with people. That's why they go ahead and co-opt those things. I mean, but also I think like in North Carolina, of course, has a really robust neo-Confederate movement, right? And so we've got a lot of white supremacists here. And I am fortunate that a lot of the partners I work with have been more open to me being like, the anti-abortion folks are the same people that you're tracking, the white supremacists. And I think it's important to really help make those connections. Like for North Carolina, like when I said that, the anti-abortion restrictions really started in 2011, it was parallel to the voting restrictions in North Carolina. Like those things were done at the same time. And it's all about establishing, yes, like this white supremacist state. And I think helping people understand too, like the anti-abortion movement, there are things that the white supremacist movement will also take from the anti-abortion movement as well, in terms of like, I feel like the violence, like sort of like the moralization of violence, which has happened on the anti-abortion side. Like we are, like when they talk about the violence they do as not violence, but that they're like commanded to do, or like whatever, how they sort of justify their violence. You really see that being used by the white supremacist movement. And so I see like things going back and forth between those two movements. But I always feel like at the heart of the white supremacist movement, like it's not like anti-abortion is a value that they just kind of have tagged on to their movement, like it's central to their movement and the world that they want to create, which is controlling the reproductive lives of whoever they consider like it's marginalized. Like, and that includes women, that includes white women, women of color, especially all people of color, ways that they can control your bodies and then control like really how everything is set up in society.
Yeah. And of course, if they really cared about unborn or fetuses, they would do stuff that actually does prevent unplanned pregnancy, all the things that are proven to, and they would care more about fertility clinics, but it isn't about that. It's about controlling women. Hazel did type the question, so I'm going to read that right now. What are the best ways to redirect opponents to abortion, as we are often surrounded by like-minded, amazing people, but what message/response has been more effective on changing opponents' minds, or at least neutralizing them?
This is a great question. So I think my favorite way to think about that is looking at what's happened in Ireland and Mexico and Colombia and sort of traditionally Catholic countries, because as they become more progressive around abortion rights, we become less. And in Ireland specifically, they took what Tara just mentioned really seriously, which is the co-opting message. So instead of trying to respond and be like, no, you're doing this, or when you say this, or when you talk about killing babies, that's not right. So anytime you actually give any credence to the message of the opposition at all, it actually reinforces their message. And in the US, we have not been good at that. We've been wanting to morally chase and explain and counter, and that actually is fed into the narrative in a real way. So for Ireland, what worked for them won't necessarily work for here, because we haven't shown that we care much about people's lives lately, but they really turn it into a conversation about love and caring for mothers, daughters, aunts, friends, partners, whatever it is, and really talked about it from a love perspective. And they just ignored over and over again the conservative narrative around murder and babies and all of the stuff that we see all the time. And it worked. And it won't work here on that scale, most likely, because like I said, we have lost a lot of humanity around lives and people. But I think making sure that you're not actually taking the bait and responding to the falsities, but instead coming from a place of love and apologetic explanations around healthcare, really just being like, this is how it is. It's, you know, we're not going to talk about if, when, you know, whether someone deserves the right to be. We're not going to say, no, you're wrong. We're just going to come at it from a place of love. Easier said than done, but that's one of my favorite examples.
And my addition to that would be education, 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 and start young. Because I do think that a lot of this falls at the feet of the lack of sex education that people have put forward across the nation. I mean, I live in a school district that, you know, is abstinence only, and that's a joke, except it's not funny.
And I would also add to what everyone has said about like the idea, of course, like one of the things I think about, the reason that they can pass so many abortion restrictions is partly because people don't really know a lot about abortion, right? So they believe what is being told, right? Like when the anti-abortion folks stand up there and say, we have to pass this ban because this thing is happening, I'm like, well, that's not really happening. But then, and it's hard to have to try and always like be correcting that kind of stuff. But I think having these discussions, like helping, like, I really think if people understand, like even people who are sort of wishy-washy about abortion, like if they really are, if it's demystified for them, they'll be a lot more comfortable supporting it because they just, I mean, even people, I've been in rooms with people who are support abortion access and they'll still repeat lies, right? Because it's just out there and we haven't been, you know, and that's partly like, I want to say like we're not always good about correcting it, but also we have a media, right, that constantly, like if they talk to me, they got to talk to an anti. I'm like, well, they're just lying, and what am I supposed to say, right? You know, so I think helping people really like, then when people share their stories or share experiences or just even share, be like, no, actually that's not true, you know, and just go ahead and say that, even if it's at your dinner table and it's Thanksgiving and nobody wants to have a fight, blah blah blah. Like, go ahead, like you can still bring it up in a way that doesn't amount to a screaming match, right? Like you're just saying, actually, that's not true. Like you can have your feelings about it, but really we just need to come from, this is what the truth is and this is what is accurate. Because I do think that allows them to pass these restrictions, because people just are like, oh, okay, I didn't realize that was happening, so we have to deal like that. Well, it's not happening, you know. So then when you have that, when people have a lot more information, it'll make it a lot harder for them to share all those inaccurate statements about why they're passing these restrictions, when really they just want to pass the restriction. They just want to make sure people can't access abortion.
Thank you. I apologize. I missed one question. We have Jesse's question and then Thomas's. I'm just going to read the questions. Jesse says, I would love to hear more about the potential for medical abortion pills by mail to support folks in restrictive states. I've been hearing more about the importance of putting resources into that solution, and I'm curious what the panelists think of that, and also if how states will be able to restrict that access.
I love this question. I think a couple of things. One is medication abortion has made it so that, you know, we are less likely to go back to the pre-Roe world that Ari, you were describing so well, because there are these options. However, medication abortion is not the panacea, and it is not a full alternative. And in part, that's because you can only access medication abortion up to, I think it's 10 weeks. Yeah, 10 weeks, about 2.5 months. And so when you think about all these restrictions that are at 15 weeks that we're worried about, it's not a solution for everyone. It is a solution for folks who are in rural locations who need to then speak to have a telemedicine appointment and then can get access to it through either the mail or through a local pharmacy. But that also requires laws that allow for telemedicine appointments to take place and for prescription to take place. And I can throw a short blog I wrote in the chat about it, but there's a lot of interesting pieces about COVID-19 and how it actually opened up some of the telemedicine laws. It actually increased access to medication abortion. However, the FDA maintains some really restrictive, politically motivated policies, which still make it impossible to get it over the counter, even though it's been proven time and time again to be safer than Tylenol. And so there's still a lot of restrictions around it. So in some ways, yes, absolutely. I think it's important, telemedicine and access to communities that can't access it. put money in it, but let's not be fooled that that's sufficient to provide access to everybody who needs it. And you still require a progressive enough state to allow for telemedicine appointments and abortion pill prescription. And, and that doesn't always cross state lines, and especially after the emergency provisions of COVID-19 are taken away.
Thank you. And next I have Thomas's question. Thomas says, I live in California. If Roe is overturned, has there been any thought about creating an abortion underground railroad to access states like mine?
So I think that what you're kind of getting at is basically what the Abortion Fund Network is. We try to get away from the, terminology around like underground railroad, just because it speaks to, a different situation. And it's also, I think it downplays what the Underground Railroad meant. But I think that, and I think I was trying to kind of getting that when I was speaking earlier, is that the abortion funds, they've already kind of created this infrastructure that has practical support, that has logistics, that gives funding. And I think that we don't need to even worry about creating these new systems. I think that we're really lucky about that although a lot of folks are just kind of learning about some of this stuff happening, there are folks who've been for a long time in the trenches about it. And so I would say, if you live in California, support your local fund. There's several in California, but even better if you want to support in a lower access state, and a state that it's more difficult to access, feel free. I shout out to the T Fund in Texas. I'm a big fan of theirs, but there's so many. There's not a single one I don't like, so I'm kind of biased. But I would say that we have that in place, and to really, really tap into those abortion funds, because they're doing incredible work, and they just deserve to be uplifted and supported.
Absolutely agree. Like, those networks are there, and so getting involved with the networks there and supporting them, because they're going to need that support. And then also, of course, reminding ourselves that that's not sustainable. Like, it is not appropriate for people to have to cross state borders to get healthcare. And so I think also for like wanting to, like, if you're thinking what you would do, I mean, like, really, you got to talk about abortion, and you got to like bring it up. You got to bring it up when you talk to candidate forums. Like, it doesn't matter what the election is, ask them about it. If they're running for school board, right? Like, what do they think about sex ed curriculums? Like, like all these places. Because I mean, we have a Proud Boy literally just is going to run for a school board, right? Like, so what we're seeing is like, we need people to be really talking about abortion. Like, I think it is easy for people to feel like, what, lots of people do support it, right? And so, and then like thinking like it's not going to go away or something. I'm like, we just need people to be loud, and they, to the point where like they can't ignore us, like, because that's what has happened, right? Like, we've said so many people support abortion access. It's definitely a majority opinion. People have lots of feelings about it, but they ultimately, like, I can't make that decision for other people. I'm like, that's fine. So we're asking, and people are going to have to really be like, not setting that to the side, not letting that be like, that's something that's going to be figured out later, to really be like, nope, we are not going to put up with this. Like, this is not the society that we believe in. And really take that stand. I mean, so support the local abortion funds, and also know that we have to make sure that people can access care in the communities where they live. Like, that is ultimately what we want for folks.
Yeah, well, I think that's a good note to end on. I was thinking, thank you for bringing that up, Thomas, because I was thinking about Texas, how they're making laws to even prevent people from getting abortions in other states, which is scary. But there are mechanisms in place to help people travel, but of course that should not be the end all be all. We shouldn't have to have that. Well, I just want to thank everybody. This was so great. This topic is really hard to talk about at this point because of all the restrictions, and it just seems like there's bad news and more bad news every day. So I wanted to do this so people know that there is hope out there. There's people fighting. We have, we haven't lost yet, and we're not going to give up. And thank you for sharing those links. I'll leave the chat open a little longer so people can grab them. But yeah, please get active. This is a really important issue. And if you do, you get to work with great people like this.
As we now say, become an accessory to the fact instead of just an ally.
Thank you. Well, good night, everybody, and happy International Women's Day.
Thank you so much.
Thanks, everyone.
Thank
Take care.
Thank you so much.